Neither the El Paso Medical Society, its members, nor PBS El Paso shall be responsible for the views, opinions, or facts expressed by the panelists on this television program. Please consult your doctor.
Good evening. I'm Emily Loya, the station manager here at PBS El Paso, and we're excited to bring you tonight's special episode of the El Paso Physician, exploring all you need to know about the coronavirus. We also want to remind you that it's pledge time here at PBS El Paso, which means it's your opportunity to support the programming that you love and depend on, like the El Paso Physician. Local programs like El Paso Physician are not possible without the ongoing support to the station provided by viewers like you. We encourage you to pick up the phone and call the 1-800 number on your screen to donate or to visit pbselpaso.org to make your contribution tonight. The whole reason this program exists is because of you, our viewers. For over 23 years, we've been bringing experts to shed light on one of the most important issues facing your family, your health care. This year alone, we brought you information about the latest developments in cardiac care, cancer genetics, pain management, telemedicine, and tonight's topic, COVID-19, the coronavirus. Tonight's episode is a shining example of what makes PBS El Paso special. Where else on television will you find a group of local doctors gathered together to answer the questions that matter most to our community? Help us continue to bring you this programming, just like El Paso Physician, PBS Kids content, and so much more by donating today. You can call the 1-800 number on your screen or visit pbselpaso.org.
The fear of the unknown. It's a powerful thing. We are hearing about it everywhere. The coronavirus, otherwise known as COVID-19. What exactly is it? How do you get it? How do you get infected? What's the incubation period? How is it treated? And why is it that some people seem to bounce back so easily and others simply don't? Precautions are being made everywhere around the globe. There are several mass events in the area that are canceling. Our president ordered some travel restrictions into the United States yesterday. College campuses around the country are going to online bases, and many dormitories are closing down. There are no confirmed cases here in El Paso. However, local school districts are canceling travel plans and any kind of mass events. Just about an hour ago, I think 49 minutes ago, New Mexico declared that all schools will be closing for 3 weeks. I say these things not to create fear at all. It is rather to try to figure out what the heck is going on, what we are facing, and what the past has taught us. We can learn from the past. We can reapply what we've done in the past. And so we want to bring to you a show of how we're going to deal with our everyday lives going forward. It's going to be fact-based and science-based. Today is March the 12th, 2020, and this evening we have with you the most up-to-date science-based information and facts. And as many of you know who watch the show regularly, this is a live program. So give us a call with your questions. I know there's a lot out there. The number is 881-0013. I also understand that we're streaming live on YouTube. You can do the search engine once you're in YouTube for KCOS TV or for PBS El Paso. This evening's program is underwritten by PBS El Paso. Thank you very much. And as you heard Emily earlier, they are breaking into Pledge Week, so please be helpful and faithful to PBS and help them out, because if it weren't for PBS, we would not be doing this show this evening. Also, a huge thank you to the El Paso County Medical Society, and we want to thank the Texas Tech Paul L. Foster School of Medicine for providing the medical students here this evening. Tonight we have Alyssa Greenwood-Francis, who is a first year in school, and we also have Bill Siddiq, who is also first year, so thank you so much for taking the time out. These two are going to be answering the phones and taking down your questions to bring our way. Again, there's tons of questions out there. So get ready. Tie on the seatbelts, as one would say. I'm Catherine Berg, and you're watching a special edition of the El Paso Physician. Hello, Catherine Berg here. Dr. Alozi is just joining us. Thank you very much, sir. I am going to first introduce our docs, and then I'm going to give you some very good information that I'm going to give throughout the show, websites and telephone numbers, etc. But we are talking about updates on the coronavirus, otherwise known as COVID-19. They are the same thing. Those are questions that I've been asked all day long, and I've asked everyone that I've known, throw some questions our way of what we need to know. But with us this evening, we have Dr. Hector Ocaranza, and he is the medical director for the El Paso Department of Public Health. And we also have Dr. Fernando Gonzalez, who is a Master's of Public Health, and he is the lead epidemiologist for the Department of Public Health. And that basically means the behavior of diseases in communities. So that is definitely what we're going to be speaking about this evening. And then we have Dr. Elosi, who is one of our veterans, and he is an infectious disease doctor and the chief medical officer for Del Sol Medical Center. So thank you three for being here. And before I ask you specifically to tell our audience what you do all day, every day, I want to give out these three, actually two websites and one telephone number. If you have questions about what we're speaking about tonight, there are some real places to go. Don't just Google coronavirus and COVID-19. Go to ephealth.com. Again, just think of El Paso, ephealth.com. Also elsalud.com, elsalud.com. So those are two places if you are website folks. And if you just want to talk to a person and ask questions, call 211. Go to option number 1, and people are on the line, English and Spanish, 24/7 to answer your questions. Very, very important. Again, phone number 211. Go to option number 1. Live questions are answered 24/7 in English and Spanish. That being said, and I'll repeat that several times. On that note, Dr. Ocaranza, we talked about this. Dr. Ocaranza, the one with the soft voice. So let's not talk about what you do all day, every day. Let's talk about what you do all day, every day from the last 5 weeks into what you foresee in the next several months. And the reason I do that, Dr. Elosi knows this, so people at home know what questions to ask of what person on the panel. So what are you doing right now? What have you been doing today?
Well, basically what we're doing is learning more about this fascinating virus. This virus started as something unknown, and that's what created a lot of fear. So we need to keep learning, we need to keep seeing the features of the virus, who is the virus affecting more, who is the virus affecting less, how can we fight the virus, and what can we do to prevent this virus. And basically the main focus of a lot of the actions that we're doing now is more on the prevention. It takes us long ways, and we can prevent not just coronavirus, but many other viruses that are circulating in the community right now, like all the flus and cold symptom viruses.
Exactly, and I know the coronavirus is getting a lot of attention, but you're right. I mean, the things that we're going to be talking about this evening are great for everything. And I do want to let people know that remember several years ago when there was SARS, remember several years ago when there was N1H1, and there was hysteria around that too. And there is reason for concern, but there's not reason for panic just yet. We are still learning everything as we're going, but there are a lot of good things coming out of this too. So if we could, Dr. Gonzalez, as the lead epidemiologist, what are you doing all day, every day? And I have to give you some street cred really quick. We've been here a good hour just talking back and forth, and you have been taking notes, you've been looking online, you've been figuring out what the latest alerts are, you're like, oh, did they know this and that and the other? If anybody can like pan into what he's got going on in front of him, you're that guy. So thank you very much for being here, and what is your role this evening?
Well, I would like to bring the latest information of the disease, not only worldwide, but in our country, neighboring Mexico, and New Mexico. This will provide us with knowledge on how the disease is behaving in our community and at individual base. So we can take the correct prevention and control measures to detect on time and to follow possible cases and contacts as well.
Nicely said. Good. And on that note, too, that is a beautiful transition into Dr. Elosi. Dr. Elosi, again, he's been on the air several times in infectious disease. Dear Lord, when stuff like this goes down, have you been sleeping at all over the last couple of weeks?
I try as much as possible
People are
to
stopping
sleep
you on
when
the
I
street
can.
corners
Yeah.
at Albertsons. So today, and in these last couple of weeks and going forward for the next near future, what is it that you are filled with all day, every day?
Yeah, I mean, I'll give you an example of today. So today, 7 o'clock, We had some of our medical staff at Del Sol Medical Center come in. We had about an hour and a half Q&A session, just kind of alleviating their fears, their concerns, explaining to them what the hospital's response is, the Las Palmas Del Sol medical community's response is going to be. We had another 12 o'clock session with our medical residents. We have internal medicine residents, and then 3 hours of phone calls between a CDC call, an HCA call, and a Texas Medical Association call, right? So those are all the sort of task force that we have. Obviously, the health department has been great at getting that information out into the community. And I think what's important for people to understand today, no cases in El Paso, right? We are working together, not just ourselves at Las Palmas Del Sol, but the health department, the rest of our hospital partners, to ensure that the health of our community is paramount.
Exactly.
Right? I think that's really the key. People, 100 texts a day, at least 20 to 30 phone calls a day, and that's fine. That's what we're here for. But again, I think it's immensely important that as of today, there's no reason for panic.
Right. And again, I don't know which one of you said it the best, but it really is time for prevention. And Dr. Ocarranza, I would like to kind of talk with you and ask first, with the other viruses that we've seen in the past, because we're going to try to refer to the past a little bit here and there. What is it about this virus that is causing all the hysteria, the fast spreading, et cetera? And I'd like to, again, the importance of the show is to keep things into perspective. And I love that, again, all that we're going to be talking about tonight are facts and science, period. So on that note, how would you describe this particular virus?
Well, you mentioned great about the past. The past has taught us a lot of lessons. Ever since the Spanish flu in 1918, all the way to H1N1, to the SARS, the MERS-CoV. And we're learning a lot on this virus based on the MERS-CoV, which is a Middle Eastern respiratory syndrome, also another coronavirus, the SARS. And we try to see if this new virus is behaving the same way as the other ones, and this way we can expect and try to anticipate any kind of problem. So we saw in the news, we saw a lot in the television when this virus first appeared in China. It was causing a lot of disease. It was unknown, the fear of the unknown, the way that you open the program, that is so powerful. So people see images of tons of beds, a lot of sick people. They don't want this to happen in our community. And as Dr. Alosi mentioned, the health of our community is paramount. That's what we're here for.
Exactly.
We're all united, working toward the same common goal. But again, we don't try to instill fear. We want to be careful.
Exactly. And that's beautiful for Dr. Gonzalez. If we can talk about specifically your communication efforts with the local authorities, then we're going to the state of Texas. In some ways, New Mexico, that's really who our neighbor is, and Juarez. If you can speak to the communication that you guys have set up, it's super impressive, if you ask me. I mean, the last several days, just once we figured out we're doing this program, the amount of alerts that I get, and again, it's up to date. Every several hours there's something new that's out there. So speak to that if you could.
Yes, absolutely. We have learned, Dr. Carranza was touching the point that learning, knowledge, best practices are always a good asset for our practice. Dr. Alosi already spoke on the workload that we have communicating with federal, state, local. But from an epidemiology point, we need to communicate and exchange day-to-day, clear, concise information with our neighbors in Mexico and in New Mexico. I receive 2 phone calls a day from Juarez. I receive a nightly report by the Office of the Ministry of Health of Mexico about the situation of coronavirus in the country by state. And every midday, we establish contact with New Mexico. So that's the way that we know what is happening, what the community is sensing, what routes or venues we need to walk in order to better inform our community on time and with quality information.
Okay, nicely explained. Dr. Alosi, as the infectious disease doc on the panel, and let's talk about the past a little bit. So what have you seen in the past in the, I don't want to call it hysteria, but I don't know what word to use. It's the overcautiousness that is alarming parents, alarming people at work, stay at home, etc. What have you seen in the past and how things have played out? And where do you see this going? I know I'm asking you to look through a glass bubble, but in your opinion, let's say it that way.
I think there's a host of things. Obviously, as an HIV specialist specifically, I'll go back to the 80s. Right? So if we look at the 80s and when HIV first came on the scene, the hysteria around it, Ryan White being taken out, right, of his school in Indiana, and a host of things that happened around that. And to talk to what they mentioned, I think what was important is that the more data we got and the more knowledge we got, the more we were able to manage that hysteria, until the reality is that in 2020, HIV life expectancy is the same as somebody living without HIV. I completely understand the fear that people have. We're all afraid of the unknown. Right. And a virus coming out of China is kind of like a Dean Koontz novel, right? From back in the 80s and 90s. And he actually called it in one of his novels that would come out of Wuhan. And so I think people are afraid of that. People are afraid of the unknown. Viruses are something that we don't really understand most of the time, especially because we can't see them. And so this is probably about 4 or 6 weeks ago, met a little 6-year-old, Sana, and she said, "Hey, Dr. Alozi, how can I protect myself against coronavirus?" And I said, "Well, you got to wash your hands, and you got to not go to China." That was then. And it's interesting because that has been the mantra for a host of elementary and middle school and high school kids. We're way past that now, right? We have over 1,000 cases in the United States. Again, our geographic isolation in El Paso, which can be problematic when you're traveling to the East Coast or out of the country, is probably a blessing to us right now, right? There's no direct flights from Italy. There's no direct flights from Wuhan. There's no direct flights from Europe, where the epicenters are. And so we're able to at least react, predict, and try to come together as a community over the proper plan for our community. And so I think, again, people, they shouldn't drink bleach. There's no reason to go crazy about this. We will deal with this in due time, and there's a host of projections. If you read the internet, you lose your mind on this, right? And so I tell people, stay away from the internet. You know what I mean? Enjoy your parents, enjoy your kids. You got to live your life. And so for those that say, should I go on vacation? It's really up to you. If you believe that your anxiety is going to take away from your vacation, then hang out here. But if you aren't worried about that, and especially if you don't have an older adult in your home, an older parent, an older grandparent, somebody that's immunocompromised from lung disease, maybe takes Imuran or one of those medications that reduce the immunity, continue, right? But I think we have to have an abundance of caution. Should you go to Seattle today? Probably not. Is LAX the place that you want to show up to? Unlikely. New York City? Probably not the place to go, right? But again, we are probably, and I defer to the experts to the left of me, we're probably 3 to 4 weeks away from seeing cases here that will make us change some of our thought process. But for today, 0 cases, and we have to continue to live like that.
And that is so nicely said, because I wanted to somehow address that specific point in that there's an incubation period. And what I'd like to do, there's a set 2, and I'd like to get set 2, slide 1 up on the air if and when we can, as soon as we can. Dr. Ocaranza, I would like to ask you, because we were talking about this before the show, there's just going to be a natural spike only because there's an incubation period. It is in the United States. We're going to hear about numbers, but that is to be expected right now. It's not that, oh my gosh, it's become spread like crazy. There is just that time frame where it's going to happen. And again, there's the point that a lot of people that are being infected are not dying. And the reason this slide is up here, and I know this is super duper tiny, but I don't know if you can see that on the air, but we've got this slide up here, which is the comparisons of the other viruses throughout the years and where we are with the COVID virus. So you will notice that, yes, there is a mass number of infected folks, but the mortality rate is low compared to many of the others. And that's so important to understand. And Dr. Ocaranza, if you can explain to the audience what you and I were talking about just when we were sitting at that other table earlier about that statistic and the denominators.
Yeah, definitely. And what we want to tell the public is, okay, we hear that people die. Every year we have people die from influenza.
Exactly.
Every day there's people that have other conditions that are not well controlled, as Dr. Alosi said, that we need to be extremely cautious with those kind of people. And those are the people that are going to suffering from all of these viruses. And definitely we expect that the numbers in the cases are going to keep rising, and they're going to rise sharply. But probably what we're going to see is that the people that are being greatly affected by it and end up dying might not be as much as we saw initially. And we're going to see that, yes, everybody is getting infected, but they got better. Staying home, just keeping well hydrated, and monitoring, making sure that they don't get sicker.
Exactly. And Dr. Gonzalez, this is, I actually have some questions that they're pouring in already. So a question here from the audience, and I'm going to respect this one because we just talked about it. No, there has not been a confirmed case in El Paso yet. That will happen, though. I mean, it's something that will happen. Let's talk about tests, because that's something, too, that it's not easy just to have a virus show up and boom, now we have a test for it. There is some science that goes into that to develop the test, which takes a little bit of time. And so that's where people get like, well, do I have it? Do I not have it? Talk a little bit about if someone is not feeling well. What should they do? Should they go to the emergency right away? Should they go to the doctor right away? I know the answer is no, but explain why, Dr. Alosi, but explain why they shouldn't just run and go to the doctor's office or emergency room or urgent care.
Not to expose others and not to be exposed from others. That's the message. So this is very important because, you know, the first thing that you think when you start getting sick, influenza-like illness, or your wife or your dear ones, you tend to run to a 24-hour clinic, to the emergency
it's a natural
room.
Thing to do.
Yeah, early morning where you're with your physician. So we are recommending to stop this practice, right? Call first.
Right.
That's public health.
Again, 211. Option 1. I'm just going to throw that out there as much as we can. 211
Absolutely.
Option 1. If you have a fear or a thought that I might be infected, or I just don't know what's going on, is this a cold, is this a flu? 211 Option 1, Spanish, English, 24/7. Continue.
Yes, that is correct. So we need to make that a best practice in our daily life. Not run into the healthcare provider without noticing. This is not a good practice, and it can pose danger to the individual and to others.
Right. Beautifully said. Getting more questions here from the audience. I almost want to go to, actually I'm going to answer some of these questions here from the audience. The patients are positive for symptoms and not being tested. We talked about that. So let's do this. Let's talk about, because that's where the questions are how does one, or how do we conduct the test to see if someone is positive for COVID-19? And who would like to take that one on? Dr. Alosi, it's almost like your turn. Yeah, it's your turn. But I can throw it to someone else too.
I'll start, and I'll
Okay.
defer to Dr. Carranza
Okay.
if I err in my ways. So I think, first of all, the message has to be around reach out and triage. Historically, in El Paso and across the nation, we've probably gotten out of the proper utilization of our healthcare system, right? We use emergency rooms as our primary care. We go to a host of places that shouldn't be the first port of call. If nothing else comes out of this, I truly do hope that we can sort of do a reset and a re-education of our community to understand if you're sick and you feel you're sick and you have a relationship with a primary care doctor, call them first, right? If you feel you're sick enough and the wait time is potentially too long at your primary care, go to an urgent care first, right? Let the urgent care potentially triage you and then direct you back to the primary care or to the emergency room. If you have a loved one that has background medical issues, they're a lifetime smoker, they're diabetic, they have lung issues, they're above 60 or 70, they get a fever, shortness of breath, and they've either traveled or come in contact with somebody that's potentially sick, I think then's the time to say, we probably do need to go to an emergency room.
Okay.
Right? And I think that's really the thing. Again, I defer to my colleagues, but the health department, correct me if I'm wrong, only has about 400 tests.
Okay.
Right?
That is
We're a
correct.
And
mil-
so that's the key
yeah,
right
we're
there.
a
So
city
let's
of a
talk
million
about that.
people.
So the tests are specific to someone who really is showing more than just a few symptoms. Someone who's really, you know what, this may really be, and now the test comes in, versus I've got a cold, I might have the flu. And it's not that tests don't want to be disturbed. And that's something, and I don't know where the information's coming from, but we have quite a few callers that are asking very specifically about why people aren't being tested in El Paso. I think they probably, and you tell me, have people been tested in El Paso? Have we had someone that has had the symptoms severe enough to be tested? Perhaps that's the question.
Well, we are disclosing information on a positive case. We're not
Okay.
disclosing the number of tests that we are providing, but I will follow, the statements of Dr. Losi, because strictly we need to establish criteria in order to select the persons that are going to be tested. We have other influenza-like illness diseases, infectious
Exactly.
diseases that need to be discarded and need to be bring to the table before we start testing for coronavirus, with not because of the number of test kits that we have, but to do the right thing on the diagnosis process that will take the doctors to give a final adequate treatment.
Right.
And if I may add,
Yes, Dr. Losi?
I think it's important for the community as a whole to understand that when you're in this space, right, around an unknown spread of disease, there are multiple phases, right? So there's containment and mitigation.
Yes.
Right now, we're in the containment phase, right? We'll test suspected patients, ensuring that they have it or they don't have it, and then it's sort of a seek and destroy mission, right? If you find a case, you find their contacts, you quarantine them. Those that need to come in-house to the hospital, we manage them. I hope we never get there, but at a point that we do get there and we're at a mitigation standpoint, which is to reduce the severity or reduce the effect, we probably will have a lot more tests, right? The CDC will put out more tests. We have LabCorp, we have Quest, we have CPL partners that will have tests. And then we'll be testing people to determine whether they need to go home and self-quarantine
Right.
or come in-house, right?
Right.
Because again, we as a community can't truly understand how much community spread we have unless we're doing more testing.
Right.
We're not there now because we have limited resources and we have to ensure those limited resources are used for the sickest. At a point in time, we will be there. But that's just not today.
No, and that's beautifully explained, because it's not a willingness to do so or not, it's just simply factually based that the number of tests are not there to do that many,
Exactly.
just to throw tests out there. It's not like everybody can go get a mammogram tomorrow and see if they have breast cancer. And I want to, be very specific on that. Dr. Ocaranza, we spoke earlier. I want to talk about, because believe it or not, it's already 30 minutes into the show. I want to talk about, we mentioned earlier about comorbidities and people who are really having a hard time with this virus when and if they're infected. The majority of them are older people that have other issues. And I'd like you to speak specifically about that, because even if testing does go on, and unless you have some really big underlying conditions, then you're probably going to be okay. So taking care of yourself before you get infected, if that's, just again, I feel like we had this whole show an hour before this show. Now we're just going to do it on the air, if that makes sense.
Yes, and we'll give the summary to all the people so we
Okay.
can give them the juice of all this.
There
and,
you go.
And definitely, we all have a loved one that has diabetes. We all have a loved one that has high blood pressure. So what are the chances that you can do well if you get the flu, if you get the coronavirus? Control those conditions. A person that cannot control those conditions and take it lightly, and all of a sudden they feel sick, they're going to get very, very sick. So those are the ones that are going to end up suffering, and the whole family is going to end up suffering. So it is a community, it is a family affair, per se, if I want to call it that. But it is a job of everybody to stay healthy. If we have that loved one, our abuelita, our abuelito, sitting there eating their sweet bread, and they have diabetes, hey,
Right.
let's get you better. I don't want you to get sick.
Right.
How can we take care of all of us, including you? We want you around the family for a long time.
So I'm thinking right now, I'm sitting at home and I'm listening, and the words very, very sick. What does that mean? And again, we haven't seen it yet here. I respect that. But to expect someone to get very, very sick, for them to think, and again, it kind of goes back to that testing. Am I going to get tested for the flu? Am I going to get tested for COVID-19? When you say very, very sick, what are they expecting?
Well, they expect that one day they're going to start having the fever. By the night, they're going to have the problems breathing, that they cannot breathe or turn purple. And the next thing you know, they're inside of the hospital in an intensive care unit. they can get very sick and very fast, and their physicians are going to do a very extensive workup to include other more common viruses like the influenza virus, like other causes of pneumonia, and then definitely they will test for the coronavirus. But if you have the influenza virus, there is a treatment.
Right, exactly.
You can get treated very appropriately because let's put this.
And that's something that's known. And again, the to be known is the coronavirus, but at least that's something that you can treat. And if we have the opportunity to do that. Again, I want to do a favor and just shout out respect to PBS El Paso, because they're the ones that are breaking through their pledge drive to actually bring the show to you tonight. So if you are usually a pledge drive guy, I was joking earlier that instead of watching Lawrence Welk right now, you're watching us. So feel free to throw some money PBS's way, because it's because of them that we're able to do a show like this. If we could cue up slide number 3. And this, to me, is what we were just talking about, Dr. Ocaranza, is the specificness on the mortality rates by age. And when we get to that, sorry, set 2, it'd be set 2, slide number 3. It's the one with the red graphs on there. I keep looking at the set because they're going to pop that up. So this is what we were talking about just a moment ago. And the ages of 10 to 19, it's 0.2%, and then we're looking at 14.8% at 80 plus. And a lot of that is naturally, as you get older, you just have other issues. But who would like to talk about this slide? Dr. Gonzalez, would you like to talk about this?
Well, yes, this graph demonstrates very, very graphically the mortality in the age group of 80 years and more. Goes to 15, almost 15%. Just if you move that into the 70-year age group, you will see the half.
Okay.
If you continue that, you will end with less than 0 percentage of deaths in the groups of children in young age.
And again, it just goes right along with what we were talking about earlier. And I want to be fair that this slide, this graph, is from, the source is from the Chinese Centers of Disease Control. So this is still contained, it's about 2.5 weeks old, I would say. So
yes.
Again, on a daily basis, and not even that, as we were talking about prior to the show, literally every half an hour, one of us are getting alerts. And if my feet are on the bottom of this table right now, and I'm hearing phones buzzing, I don't know which one of the 3 of you, if it's not all 3 of you, we're all getting buzzed right now. And so on that note, we are on it. And there's a lot of questions here saying, okay, when are people gonna be tested? That's another testing question. That's another testing question. Hold on, I got a new one here.
I really want to talk about testing.
I know, and I don't want to, so you know what, let me do this, because I don't want to get too focused on one thing. I usually stop questions later into the show. Let me stop them now for a second, because you 3 are the ones that I want to hear from. Dr. Alosi.
Yes, ma'am.
What do you want to say to our audience tonight? What is it, and I know you've been talking a little bit about it anyway, but we've got a whopping 25 minutes to get whatever information out to the audience that we can. A lot of the questions here are testing, so I'm going to wait for what you all really want to communicate to our borderland community. You beautifully said isolation can be a blessing and a curse. Right now it's a blessing. That's one thing that I think we can focus on in a positive. A lot of questions that I'm getting is back and forth crossings of the border. Medically, a question, and then economically, a question. We don't need to deal with economically the question. That's not what we're here for tonight. But maybe take it from there and just talk to the audience and what you want them to know from you.
I think where we are today, right, March 11th?
March 12th.
March 12th.
Close.
I'm disorganized, completely out of it. But I think March 12th, where we are today, for our El Paso community, is sort of a watchful waiting. Right? You hear the news every day. You see the case count, whether on the CDC website, the New York Times website. They have great maps that are there. And I tell people, because I get this question all the time, what should I do? But there's not a lot you can do. I would say this: if you have an elderly parent, if you have an elderly relative, ensure that they have their medication, right? If there's anything that they need to do to get healthier in the short time, do that. But have at least a month, 2, 3 months of medication. Right. And I'll explain that in a second. We've all seen the pictures of the runs on water and toilet roll and a host of other things. Purell is $50 a bottle on Amazon right now. You know, a lot of things that, again, are a little bit crazy, but you can understand the concern in the community because it's all we're hearing in the press. If you need to do those things for your anxiety, for your comfort, then do them. Get your water down, get your toilet roll, get your beans or rice, whatever it is that can stay. And here's why I say this. Irrespective of how the coronavirus will affect our community, because we would have to be a little bit delusional, gentlemen, I think you'd say, to say that we're not going to get any cases.
Right.
But if you imagine that our level of anxiety in the community is here right now, once we get our first 1 to 5 cases, it's going through the roof, right? And then think about what happened in Houston today. I think 15 cases in Houston, 10 of them were around HISD, 1 or 2, either a parent or a child was there. They've shut down HISD until March 31st. The exact same thing will happen here.
Right.
Does that change our health? Definitely not. But what it does change is if you can't go to work for 2 weeks, if your children can't go to work for 2 weeks, if there's already a run on toilet roll and water and all the rest, you want to be prepared for that.
Right.
The worst case scenario is that we're lucky, we're blessed, our geographic isolation helps us, and it doesn't happen, right? And we're just fine. But if it does happen, you're prepared.
Right.
And so I think that has to be that sort of logical and measured approach to something that we see may happen, but is not here yet.
Right. Beautifully explained. Dr. Gonzalez, how about you? What would you like to tell? I want you just to go through all of your papers there and spread them all out onto the table, and then blindly just pick, boom, that's the one.
Can I pick?
No, I love that. I'm funning with you because you're how I roll. I mean, okay, look at me, right? I mean, look at all this. So I get it. I respect it. I love it.
For this one, I was truly prepared.
Good.
So I don't need that. Let's go to basic hygiene practices. Hand washing will decrease the risk of any infections that can be transmitted through our hands more than 60%.
Yes. And we're talking soap and water.
That's it.
So it's
No
not like
more
you
than
have to
that.
have the runs.
Yeah,
Anxiety,
dynamic.
fine, but soap and water and in a certain amount of time, sing your favorite song, maybe twice. It could be a Kiss tune, it could be Carly Simon, it could be Lawrence Welk. It doesn't matter, right?
Absolutely.
Just sing and take the time with soap and water.
Right. Energetic, a lot of foam, your nails, inner fingers, you know, be dynamic with that hand washing. And then right after you can touch your face. Before that, please don't do it.
Right.
Viruses will go, eyes, nose,
Right.
and mouth. Okay. Cover your secretions. This disease or this virus has a free ride in droplets, integrated by mucus or by lung secretions. They fly up to 3 feet. If they don't find nothing, they will stand and drop into surfaces. You come, touch your surface, darken up your cell phone, your computer
Cell
screen.
phones is something nobody talks about, but my Lord, how many germs are on our cell phones?
Absolutely.
Right.
So those are surfaces that need to be clean.
So somebody said it to me, it was a teacher, that said that she's telling her second graders, any of the wet stuff that comes out of your body, and if it touched anybody else's wet stuff that comes out of their body, nose, ears, mouth, anything, that's how she's describing it. And I thought, that's perfect, right?
brilliant.
That's just right on cue. So on this note, before I go to you, even today when we walk in, El Pasoans love hugging and kissing each other. It's what we do, right? And then there's the handshake, and then over the handshake, so it's like, oh, that's right, we're not shaking hands, and then we're hugging. It's like, well, it's clothed to glow. No, you can't hug. So in general, I'm having fun with this, but it's a true thing. When you are in business or it's just naturally shake hands, we were talking about hygiene. When we're greeting everybody, when we are out in public, when we are working, when we can't be isolated, how are we asking that? I know there's the elbow one,
Right.
it's the, if you want to do the bump, you can do the bump. But in general, what are people
bumps.
doing?
No bumps.
No bumps.
No bumps?
We're
No
done
like
with-
hip bumps?
Oh,
Okay.
hip bumps.
The hip
Hip
bumps.
You can do a hip bump.
Yeah.
You can do the kid and play foot
Back in the
touch,
days when we were
right?
dancing.
Right, right.
Exactly.
But are we suggesting that people don't shake hands? I guess that's the bottom line. We're suggesting people do not shake hands.
I think we are at the stage of preparing people for social distancing, right? Social
so sad, but yes,
yeah,
I get
it's
it.
sad,
I know,
but social
I know.
distancing sounds really easy, but we as a culture, especially here, are not trained and prepared to distance ourselves from each other. You think Dr. Carranza mentioned it when he talked about abuelita and abuelito, right? That we're used to having grandma and grandpa in the house, an
Right.
aunt or an uncle, a tia or a tio. Somebody's in the house, they're always around. And we have to figure out ways to engage with our culture but stay safe. So whether it's an elbow, whether it's a nod, whether it's a foot bump, whatever it is, we're gonna have to start to change the ways that we engage. I think where it starts to hit people that they actually know it's real is there's a travel ban to Europe now,
Right,
right?
right.
The NBA has suspended its league. NHL has suspended the league. MLB has suspended the league. The Locomotive sent out an email today that they're suspending their league, right?
Right.
And so I think those are the things that have to start to prep us to understand that this is real, right? And we're hoping we never get to Seattle levels, right?
Right.
But we have to be prepared for them. And I think everybody here, the medical community as a whole, we're trying to prepare for what may come into the future, right? And hopefully also trying to prepare our community for the steps that they need to take to engage with it as well.
Nicely said. And again, if you know you have underlying conditions, try to keep on top of those because your chances of getting through this, even if and when you are infected, you can get out of this okay.
Can I say one
Yes,
last thing?
absolutely. Dr.
And I'm going to
Rossi?
speak the which camera is on here?
It's right now it's one with the red light.
All
but
right,
well,
that one.
There you go.
I need to speak to my medical colleagues in El Paso. I understand that on average we think we're Superman and Superwoman. I understand that a lot of us have private practices, onesie, twosies, we're not employed. I think it has to be imperative for us to understand that if and when the coronavirus does come to El Paso, if we become sick, we have to take that step to self-quarantine ourselves. We touch 50 to 100 patients a day, and it would really be a tragedy if the medical community is what drives this infection in our community again. And so again, to the medical colleagues out there, if you haven't started to plan for what you're going to do if it touches your secretary, your MA, your PA, your NP, your co-partner, how are you going to manage through the hospital? Texas Medical Association just put out a one-pager that has a host of links around what to do when your practice is closed, the insurance that you need, the health insurance, how do you get disaster relief insurance, right? Those are all the things that people need to start to look at today so that when and if that time comes, you're prepared.
Right, and that's beautifully said. Again, infectious disease doc, you're the one that gets it. Not that everybody else gets it, but on that note too, I wanted to give out for the providers, medical providers, doctors, the website, registereephealth.com. And if you register there, Dr. Gonzalez was talking about you will get up to date. I mean, literally, once you get the information, you send it out to all the doctors on what that information is. So again, if you are a healthcare provider in any way, shape, or form, register.ephealth.com is the website for you to go to. For everybody else, because I said I like to mention this as much as I can, again, if you are curious on what is happening in El Paso as a general public, you can go to ephealth.com. So it's the same website, just the providers go to register@ephealth.com, but www.ephealth.com, and then also elsalud, ELSALUD.com. And if you have any questions at all, phone number 211. Again, just choose option 1. You'll be prompted to do that. You can ask questions 24/7, 24 hours a day, 7 days a week, live. People are going to be talking to you, and it is both in English and Spanish. So that is very, very good. And again, praise and adoration to all you guys for putting that together, because it matters for a place for people to go. And there they are on your screen again, those 3 websites. Again, that last website is specifically for providers. Question here from the audience, and Dr. Los, you talked about this, and this is about, again, anxiety. Hand sanitizers and other soaps are running out. What should we do? Again, whatever soaps you can use, whatever might be around, and it might be a good time, you said, if we can get something, we can now.
Yeah.
I know that companies are on it because everybody, at the end of the day, wants to be able to sell their products. Question here. I'm going to give this one to Dr. Ocaranza. Treatments available for other types of coronaviruses. So coronavirus 19, that's the specific strain that we're talking about right now. But there's 18 before this one.
That's
Right?
right.
So that's something that a lot of people don't know. There's 18 coronaviruses before this one. This just happens to be the little sucker that's messing everybody up. But treatments, and then I want to briefly talk about when we might be able to see a vaccination. A year from now, 2 years from now, we don't know exactly, but it's nice to even start that conversation. But what treatments are available for other types of coronaviruses, and or you were talking about the flu, again, people who might not be on that cusp to feel like they're sick enough, or whoever is in charge doesn't feel like, you know, the testing for you is not appropriate because you've got these other underlying conditions. What are some of the treatments that are out there?
Well, there are some other coronaviruses that causes upper respiratory tract infections, even problems breathing, cough, and it's one of those viruses that circulate in the winter season that causes a cold on all of us. So the treatment, there's no specific treatment like the way that we have for the influenza virus. What do? Then we need to treat symptoms, the complications, whether they come. Are we working on getting a vaccine for these novel coronavirus? Definitely the industry is working on getting something. And they're testing medications to see whether it's going to be effective or not on those patients that are affected. And I know that they were using some medications in China. So the specific treatment, there's no specific treatment.
Exactly.
The best thing is the prevention. As
Right.
we mentioned over and over and over again, let's wash our hands. Let's stop touching our face. Let's practice some of the social distancing. And when we have those cases of coronavirus in the community, then definitely we're going to be letting everybody know, well, this is the time that we need to be distancing each other. Let's see how we're mitigating the spread of the virus in the community.
And on the note of treatment, and I sometimes I feel like, I know it's so simplified for us because we deal with this all the time, but there's viruses and there's bacteria. Because I have a couple of questions too in general. Well, can I just take some antibiotics? Can I prevent it? It's a whole different thing. Bacteria is antibiotics, viruses are not. On that note, and Dr. Alosi, I saw your head go way down on that, so I'm thinking that people are, it's like, oh, here we go. So I know you have something to add on that. So please do. Again, that's some of the questions here, and then if you would like to even tackle the idea of vaccinations, which again will be a while because again, this is something we're just discovering. We're trying to figure out what that may look like. It's not going to be perfect the first time around, etc.
I think a couple of things. So, bane of my existence as an ID guy is people that want Z-Paks and antibiotics for viruses.
Yeah.
Unfortunately, they just don't work. Right? And so it is what it is. I think that a couple of things. From a vaccine standpoint, if you listen to Tony Fauci, right, he's the leading luminary in the country around infectious diseases, and he clearly says that we're at least 10 to 12 months away, best case scenario for a vaccine.
Makes
right?
sense.
And so we're in March, and so in reality, maybe the end of this year, most likely 2021. And I think that's why it's important for us to understand that we have to be practicing hygiene and understanding. I would like to speak to something just to pivot off a little bit, not to cause alarm, but as you know, there are people that may have asked today whether this is real, whether this is a hoax, right?
Right.
And I think Dr. Ocaranza and Dr. Gonzalez did a great job of identifying that. Are we necessarily worried about the overall mortality of this? No. We're worried about those that are already sick and those that are older, right? But I think it's important, us as a city and any other healthcare providers that may be watching and people that can have these conversations, it's just simple math, right? You got to do the math.
Right.
We're a city of about 800,000. Even if all we get is a 5% of us that have coronavirus, that's 40,000. The data clearly shows that 10 to 20% of the people that get it will be hospitalized. The smallest amount that is 3,000.
Right.
Right?
So
3,000
it sounds crazy
to
huge when you're looking
6,000.
at numbers, right?
And if that's over a 2-month period, that's where the concern is. It may not be about how many people are going to die. It's going to be the overwhelming of our healthcare system. And so we are trying to come together, my organization, their organizations, a host of other hospitals in the city, to understand that we have to be prepared. And it's better to be over-prepared than let us get into April and May and we're admitting 1,000 people a month into an ICU and all of a sudden we're not doing due justice to our community. And so this is not a hoax. This is real. It's something that we plan to be prepared for.
Right.
We're training on it. We're discussing it. There's a million calls a day. We're prepared and we're ready. And the community just has to
You know,
be
it's
faithful
interesting.
as
There's
well.
actually a question here. How are city professionals prepping for the massive surge in El Paso, specifically with the hospitals? Again, they're on it. It's still, there's a lot to be seen, but it's not that it's going unnoticed. This is not necessarily a question, more of a statement, or I guess it's a question. Do you believe more people should self-isolate to reduce chances of community transmission, or should people without symptoms continue their activities as normal? That's a normal, everyday question people are asking.
That's a hard one.
Who
though.
wants it? Dr. Gonzalez, you know what? Since epidemiology is the containment
You get it,
of viruses and spreading of diseases, you get that question. So let me reread it. Do you believe more people should self-isolate to reduce chances of a community transmission, or should people without symptoms continue their activities as normal?
Let me tell you that not only for this new virus, but I would recommend those practices in every single influenza-like illness. We need to remember those are airborne or droplet
Or a
related,
droplet.
right? So, you know, we need to be careful on where we go, when we go, how we go. If we are sick, we need to contain. We need to be respectful for ourselves and for others. And our community is very well oriented into public health. Let me tell you, the community listens. We have highest rates of immunizations nationwide. Our community
You know what?
is a
Say
true
that again.
example.
I don't think a lot of people know that. We have the highest rate.
The highest rates within the United States, we are part of them.
Excellent. Of
Yes.
people who get vaccinated.
And we had the example with measles.
Nice.
We contained an outbreak of measles
That's
in
right.
19 days.
And
Not
that's
more
amazing,
than
and that's something we need to
90%
let
of
people
kids
remember.
immunized for MMR, measles,
Right.
mumps, and rubella. So, you know, I will leave it.
Okay. Question here from the audience. We have a whopping 5 minutes left. If I start feeling symptoms, what should I do? We talked about it earlier, but let's talk about it again. If I feel symptoms, what should I do? Should I go to the ER? Should I go to primary care? Dr. Ocaranza, you take it.
Well, if you're feeling symptoms, if you've always been healthy, just stay home. If you feel you're getting sicker, talk to your provider. We already talked about it. If you have an established relationship with your provider, call them, see where you are. The people that are mostly getting infected are the ones that travel to those specific areas. If you recently came from Italy, the last 3 days, and you start feeling sick, then definitely that's one of the biggest possibilities, but you never travel. You never went anywhere else and you're feeling sick with flu-like symptoms, most probably it's gonna be just a regular cold
Right.
or a flu.
And again, if you're not compromised with the slide that we showed earlier, chances are you will get through this. You'll be sick, but you'll get through this. It's when you have all the other issues that people have. Question here from the audience. Should the U.S. Post Office, FedEx people, similar mail carriers, etc., take precautions like wearing gloves or a mask? Not a mask. I didn't really want to bring up masks tonight, but let's do. When delivering mail and packages. Dr. Losi, because you chuckled, because masks are really only for those who are infected, not to prevent anything. That's so important. And please, how would you explain that to people who are asking you about masks?
Masks are controversial, right?
Okay.
The science behind masks are not controversial, but we as human beings believe that wearing a mask is going to protect us, right? The reality is they don't. They probably actually put us at more risk because we're not taking the mask off properly, we're touching it, we're not washing our hands, we're actually creating a host of channels that various bacteria and viruses can get into us. I think the conversation about social distancing and whether mail carriers should wear a mask or not, I don't think we're there right now. I think that we may get there, but again, it's really hard. It's one of those things where you understand where people are going with it. They don't want El Paso to become a Seattle.
Right.
but we're not.
Right.
And
Exactly.
we can't live into the future. We can only live day to day. And today, as we are, with 0 cases, I think we have to continue to go about our lives,
Right.
with the understanding and an abundance of caution that if you are sick, call first.
Right.
What I wanted to point out specifically around that is, and you and I have had these multiple conversations about technology.
Right.
And I think this is where that nexus of technology and healthcare can really drive social distancing. If you're an employer in El Paso, I think it's very important for you to start to understand what your work from home policy is, right? Whether you're using Zoom or WebEx or Skype, whatever the means is, it's important for you now to start planning. So if a third of your workforce who have kids can't come to work, how do you continue to do your work?
Right.
And I think that's critically important. And technology in that sense can help the social distancing and actually help change the epidemic curve.
And this is really a stage for planning.
Yes.
I mean, we have all this in front of us. We know it's coming. It's time to plan. You said that beautifully to your medical colleagues. Gloves, I think it's the same idea as the masks. We've got a whole 2 minutes. Question here, can the coronavirus be killed? We don't know that yet. We are working on it. Should I postpone other vaccinations? Because vaccinations, and if it's anyway, bottom line is they have some other comorbidities. Should they postpone pneumonia vaccination or the flu virus vaccine? So we are now in March. Should we stop people getting flu vaccines at this point, completely unrelated to COVID-19? I don't even know if that's
Short
something.
answer is yes.
Okay.
Yeah.
What I am going to do really quick is give out all this information again to look up real information, real-time information in El Paso specifically. The websites to go to is one, ephealth.com. The other one is elsalud, so elsaud.com. For healthcare providers who would like to register to get up-to-the-minute updates on what's happening, go to register at ephealth.com. And again, if anyone has a question, 211, just dial 211 on your phone, go to option number 1, you'll be prompted to do that. And again, you will get answers 24/7 in both English and in Spanish. I want to say thank you so much to both of our medical students who've really been working their patukas off tonight. Alyssa and Bill, good job, good job. And a huge thank you to PBS El Paso. Again, we have interrupted their pledge drive, so by all means, give to the number that's on the bottom of the screen. That's what makes programs like this happening. And also to the El Paso County Medical Society that really worked their butts off on research and helping getting this together. I'm Catherine Berg, and you have been watching a very special edition for the El Paso Physician.
Thank you to all of our guests and our student volunteers, and thank you, our viewers, for watching this evening. For over 23 years, we have been very proud to bring you El Paso Physician and provide meaningful healthcare information for your family. Please take this time to consider donating to support PBS El Paso tonight so we can continue to provide you the local and national PBS programming that you enjoy and depend on. Producing quality content is a team effort, and it wouldn't be possible without the support of our viewers like you. Please call the 1-800 number on your screen or visit pbselpaso.org to donate and share your support. No donation is too small, and your support will help us continue to provide you with the programs and services you rely on from PBS El Paso. Thank you for giving.